Ottawa ankle rules. Radiographs are indicated for the ankle if there's tenderness along the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness along the medial malleolus, and or the inability to bear weight for 4 steps. Radiographs are indicated for the foot if there's tenderness over the navicular, tenderness over the base of the 5th metatarsal, and or the inability to bear weight for 4 steps. Test item cluster for a patient who would respond to spinal stabilization. Age less than 40 years old. Average straight leg raise greater than 91 degrees. Aberrant motion present, such as pain during motion, an instability catch, reversal of lumbopelvic rhythm or pseudo-Gower sign, and positive prone instability test. Have you stand on the edge of the table down here. Try to rest your hip bones on the table. Have you lay flat and grab on there. I'm just going to apply some pressure to your lower back here, and then I want you to lift your legs off the ground, and then tell me, how does your pain feel now?
Better.
Test item cluster for a patient who would respond to spinal manipulation. Number 1, duration of symptoms less than 16 days. Number 2, no symptoms distal to the knee. Number 3, lumbar hypomobility. FABQ working score less than 19, and at least one hip greater than 35 degrees of internal rotation. Thessaly test for meniscal pathology. Have you rest your hands on the table here just for balance. I want you to stand on your good leg and then slightly bend your knee to about 5 degrees, and then just have you rotate right and left 3 times each way. Any pain or discomfort? Nope. All right, now I want you to stand on your injured leg. Again, about 5 degrees, and same thing, rotating. Any pain or discomfort? No. Okay. Have you go back onto your good leg. Have you bend it just a little bit more to about 20 degrees, and then do the same thing, rotating right and left 3 times. Any pain or discomfort? No. Okay, and then back to your injured leg, about 20 degrees, rotating right and left 3 times. Any pain or discomfort? No. Lockman test for ACL pathology. So I'm going to bend your knee to about 30 degrees. Make sure you just try to relax. Grab onto your leg here. Slump test. Alright, so what I want you to do is kind of slouch forward, bring your chin to your chest, and can you bring your hands behind your back? Now I'm just going to apply a little bit of pressure behind your head here, and then slowly straighten your leg. Do you have any pain or symptoms with that?
No.
Okay, I'm going to bring your toes to your head. Any symptoms with that?
Yep.
Okay, now slowly lift your head up. Did your symptoms go away?
Yes.
Test item cluster for a patient with hip osteoarthritis. Self-reported squatting as an aggravating factor. Active hip flexion causing lateral hip pain. Darcy, can you bend your knee and bring it up towards your chest? Do you have any pain with that motion?
Nope.
Positive scour test. Do you have any pain with that motion?
Nope.
Passive internal rotation less than 25 degrees. And active hip extension causing pain. Darcy, can you lift this leg off the table? Do you have any pain with that motion?
Nope.
Okay. Faber test for the hip. I'm going to apply some pressure here and here. Do you have any pain with that?
Nope.
Anterior drawer test for the ankle, and I'll be testing in 2 different positions. Differential diagnosis between gluteal hamstring weakness versus an L5-S1 radiculopathy. So first I would want to test the glutes and the hamstrings for their strength. So I would test knee flexion. I would do a manual muscle test with knee flexion, hip extension, and hip abduction. If any of those were weak, I would continue my testing to see if it was just isolated weakness or if there was also some radiculopathy going on. So to test to see if radiculopathy is involved, I would look at the sensation at the L5-S1 dermatome distribution, so L5 and S1. I would also test the S1 reflex, which is the Achilles tendon reflex, and then I would check to see if there's any myotomal weakness of L5, which is great toe extension, and then S1, which is plantar flexion. I would also do a slump test to see if there was any radicular symptoms. If a patient had impaired sensation at L5-S1 dermatomes, myotomal weakness, and an absent S1 reflex and also a positive slump test, I would rule in the L5-S1 radiculopathy. If all of that was intact, then I would just rule in the gluteal hamstring